Right, to a firestorm in Quebec now over the province's doctors. The provincial government recently passed a highly controversial law. It's known as Bill 2. The bill sees doctors paid a fixed amount per patient and in part links their compensation to objectives that are set by the government itself. Many doctors are outraged over what they see as government overreach here. The threats of major fines for doctors who don't comply. Some doctors are now calling on the courts to intervene. They say Bill 2 is unconstitutional. And we're seeing other effects as well. Hundreds of Quebec doctors are now actively looking to leave the province for other provinces like Ontario and New Brunswick. Even that, though, the idea of leaving Quebec could mean fines for some of those doctors. Dr. Trevor Hennessey is the head of the anesthesiology department at a hospital in the Outaouais region of Quebec. He recently resigned from the health authority. Dr. Hennessey, thanks for your time today.
Thank you very much for your interest.
You know, we're broadcasting to people across the country who may not be familiar as you are with Bill 2. Can you give me a sense of why this particular law has created such outrage? And I appreciate that there are long-standing problems in the Quebec healthcare system. I'm from there. I know this. I reported on it for many years. And that is not necessarily, you left as a result of a long-standing issue with the Quebec healthcare system. But this particular law has become a real firestorm.
Yeah, the government would like to play it as its finances and the question of pay, but really that's not the large issue. The large issue is the objectives that are being put in the law that we as physicians try to meet on a daily basis anyways, are essentially unattainable with the resources that are being provided by the government to achieve this. We just cannot meet these objectives, and essentially the government is trying to pass their failings of supporting the healthcare system onto the shoulders of the physicians. Next week, I've got 9 operating rooms out of 12 closed due to lack of nurses. I've got surgeons and anesthetists, my colleagues, sitting at home without work. But in the law, if we do not operate patients, the government will go to the public saying that we failed, and not only that, that they will apply penalties onto us.
I mean, I'm hearing that Ontario's College of Physicians, New Brunswick as well, is being swamped now with applications about Quebec doctors trying to get out. Are you surprised by that, Trevor?
No, I unfortunately had to get my license in Ontario in 2024 when we had operating room closures, not leaving enough room for my colleagues. I've recruited doctors from France, Belgium, Spain, and they legally cannot work anywhere else. And so I volunteered to leave to work at the Montfort Hospital in Ottawa, at Cowansville, Roberval, around Quebec and in Ontario to free up work for my colleagues who could not work locally.
What about these fines and whether you think that's a head scratcher? I mean, is the government really going to fine doctors who want to move to another province?
So if you really read through the law, which they say they need to explain to us, but we are able to read, and the law is extremely clear, they say essentially anything where plusieurs médecins, so 2 or more doctors, do anything that the government essentially disagrees with, then they can apply the penalties on those physicians as well as the federation as well as provincial-wide. And yes, those go up to $20,000 per day. And it doesn't require any proof of collusion between physicians. A physician can retire in Quebec City. Another one can retire on the entire other side of the province in Shawville. And the government could deem that as collusion and apply the fines on that. And be aware also that as physicians, we are independent workers. We had no pension plans, no health insurance, no vacation pay, nothing. So our goal is to our patients, and the government is essentially trying to have full and utter and complete control, where we actually have to send weekly reports to the government what every single physician is doing, and if they don't agree with something, penalties can apply.
Dr. Hennessey, it's my understanding as well that, even speaking to me right now as you're doing, for a Quebec doctor, that could also get them into trouble with the government.
That is a little less clear, but it could be seen as colluding and encouraging other physicians to make particular decisions with regards to their practice. We have to give 60 days notice of resignation. The law gave very little time. So the law comes into effect January 1st. And so I had to give my notice by November 1st, which I did. And my patient information website, trevorhennessey.com, I will be taking down my information as of December 31st, so that is not present on January 1st if this law is still in place for that concern.
What's your read on the government's tactics here?
I don't understand. Mr. Legault and Mr. Dubé are intelligent men from a business background, so they've been very vocal with regards to encouraging the privatization of healthcare. Is this a strategy to have public system go down so low that there becomes palatable to explore the private system? We have 182 private operating rooms now in Quebec that are being paid to provide public surgeries. There are positives and negatives to this, but we would raise concerns with regards to where are those nurses and respiratory therapists coming from to staff these. Very reasonable that they're making decisions based upon resources and the decisions they need to make for their families. So it's understandable, but if the public system was appropriately resourced, I don't think we'd see these same issues.
1.5 million Quebecers don't have a family doctor. You're aware of that number. So, if hundreds of doctors leave, that's only going to make the situation even worse. Now, I understand as well the government is obviously following this blowback and all the controversy now. They seem to be open to possibly talking about the law. Are you at all optimistic?
Well, it's a bit ironic because they said they needed to give us a information session this week to explain this to us, as if we can't read the law, which they completely left out during that discussion, any of the penalties or any of those. They wanted to just focus on the clinical aspects. And so it's a bit of a smokescreen. And my name's being released uncomfortably in the National Assembly. And the minister at that time was not even aware that I had formally resigned, despite my emails to him and my communications and multiple presences in the media. It's the Outaouais has just been forgotten. I think it is getting to the point where they have no choice but to really explore what these particular issues are. And I reiterate, this is not the question about the funding for physicians. This is the question of appropriately resourcing so that we can actually do our jobs. We want to care for patients. We want to operate. We want to give anesthetics. We want to see emergency patients. But we can't do that without nurses and technicians and radiology technicians and all those other aspects.
Just quickly, the beginning of the new year, are you going to be practicing in Ontario, I guess?
I don't know as yet. I've been trying to just take care of all of my media presentations. This is my last gasp to try and bring attention to this issue in our region, particularly in the Outaouais, but it's not unique in Quebec. And so emails have been sent, and I'm just doing I will see. But as of January 1st, for now, I don't know. But I'm not able to work next Monday because there's no operating room, so it's not a huge difference for me. And my leaving will just leave some extra work for my colleagues. So it's not, my leaving is not directly impacting patient care at this time, but the future may have an impact.
Dr. Trevor Hennessey joining us from Hull, Quebec, talking about Bill 2, this hugely controversial law the Quebec government passed regarding its doctors. Dr. Hennessey, thanks for coming on CTV News and giving us your take. Much appreciated.
Thank you very much for your interest.